I can guarantee that most of you watching or listening right now are suffering from low testosterone. All right, welcome back, ladies and gentlemen. This video is intended for males, so ladies, if you don't want to learn about your partner or just dudes in general, then go ahead and just skip away. I want to save you the time, so this is not meant for you. However, you do have testosterone as well. So if you want to help maximize your own testosterone to optimize your health as well, that's okay. Stick around. You might learn something. So, anyway, to start us off, it's sad today in society that most men do suffer from low testosterone. It is a given fact. It varies by age. So, according to the American Urological Association, urology is the study of the reproductive system, urine excretion, kidneys, all that stuff. Anyway, they found that 20 to 50% of men in the United States alone suffer from low testosterone. Now, that being said, there are various factors. Age, this number does increase as you age. So, say you're 40, 45 or plus, which your testosterone usually starts to decline about less than 40 years old. It's about 30 is when it really starts to decline. But anyway, pretty much every man's got low testosterone nowadays anyway. So it doesn't really matter because all the garbage ass carcinogenic stuff they put in our food, the water, all the atmosphere. I mean, nothing, you can't escape it. The only thing you can do is just optimize and control what you can. And don't worry about the shit that you can't control. Like, you can't control your water, I mean, you can, but it's very, very expensive. You can't control what they put in your food. You just don't know. Like, it takes so much consciousness and awareness of every little detail that it's almost not worth it. So, with that being said, anyway, I do want to give you guys a quick fact that approximately it is estimated that by 2060, this is sad, by 2060, most men will be infertile. However, this isn't really an issue, especially by 2060. We'll probably have other methods of fertilization anyway, and we'll probably just be growing people, growing infants, like just cloning people. Because, I mean, the way the government looks, it wants control, and the only way for it to maintain control is to strip us away of our reproductive rights. Now, when I say reproductive rights, ladies, if you're still watching, please don't go on a tangent about abortion. This is not what this channel is about. We're not bringing politics into this, okay? So just please don't. I promise. I'm not trying to stir up any garbage. We're just nothing to do with anything. So, little disclaimer there. But anyway, yeah. So the government, they will not have control. And when you don't have control, anarchy. The citizens take over. The government is like that. I mean, look at the most recent election. They're not very happy, especially the leftists. They're not very happy. So anyway, I said we're not going to get into that. So we're not going to get into that. So to get back on topic of today's video, I wish to share with you guys my personal story being on testosterone therapy. So yes, I am on testosterone therapy. I am 5 weeks in. I started at the beginning of December, the second week in December. And well, I needed it. I felt like shit. I felt weak. I didn't feel like a man. I was struggling to put on muscle. I was struggling to maintain muscle. I mean, I had no sexual desire. None. It was pathetic, dude. It was pathetic. I mean, I'm 23 years old. I should have a fucking drive to just go and just conquer the land. I had nothing. I would wake up days feeling completely emotionless. I wouldn't even want to talk to anybody. And most of you would say that's depression, but I don't think so because I've been depressed. I sat in the hospital for 7 months, in and out, constantly getting stabbed, constantly getting this, that, different procedure. I've been through that. I've been through depression. I've been alone. That doesn't scare me. But the fact that I wake up and I don't have any desire to do anything, no motivation, nothing. I'm 23 years old. The only reason that I would get out of bed in the morning and get shit going, work out twice a day, stick to my diet, be shredded year round, It's all up here mentally. I have the discipline to do the fucking work. And you have to cultivate that as well. I'm going to make another video on that. So, anyway, the most common cause, well, that's a little my backstory. The reason I needed testosterone therapy is I was born with a condition, and we'll cover that later in the video. So, um, anyway, so the topic of today's video is just to discuss why I needed testosterone therapy, why I took the initiative to get testosterone therapy, some common symptoms, some misconceptions, misbeliefs around testosterone therapy, why you should probably do it, and why you should get your testosterone checked, and some tips to help increase your natural testosterone production outside of going straight to testosterone replacement therapy. So, without further ado, let's get right into it. So, to start us off, let me give you a brief introduction of the main hormone responsible for decreasing testosterone levels. And that is a hormone called prolactin, which is secreted by the posterior pituitary gland. Now, the reason it causes low testosterone is because of the fact that it inhibits two other hormones called FSH and LH, which are follicle stimulating hormone and luteinizing hormone, respectively. These two hormones are responsible for desire, sexual function, sexual reproduction, and everything related to your balls, your genitals, whatever. And not to mention testosterone production and estrogen production in women. But when this level rises too high, it inhibits follicle stimulating hormone and luteinizing hormone. Therefore, these two hormones cannot be secreted in sufficient amounts to stimulate your testicles, your balls, to secrete testosterone. So, essentially, the effect of hyperprolactinemia, which means elevated prolactin in the blood or plasma, inhibits the synthesis and secretion of testosterone. It's very simple. I mean, it's simple but complex at the same time. So, anyway, and some common causes for hyperprolactinemia are, well, they range from various conditions such as chronic kidney disease, chronic liver disease, hypothyroidism, Cushing's disease or Cushing's syndrome, which is hypercortisolism, which means increased amount of cortisol in the blood. If you don't know, cortisol is a stress hormone. It's responsible for how your body responds to stressful situations, regulating immune function during stressful environments. It's very important. And when you have too much, obviously, you're going to be stressed. Stress inhibits testosterone production. It increases prolactin, therefore, secondarily decreasing testosterone production. There's also certain drugs that can inhibit testosterone production or elevate prolactin, secondarily decreasing testosterone production. And those are antidepressants, some antipsychosis drugs, and hypertensive medications, so blood pressure medications. And then lastly, the biggest one is lifestyle choices. So, poor eating habits, smoking, drinking excessive amounts of alcohol, eating like garbage, eating excessive amounts, obesity, not working out. That's a huge one. Working out stimulates the production of testosterone. Just overall unhealthy lifestyle habits. And considering that 70% of the population is overweight, that could mean 70% of the population has low testosterone. Well, granted, the percentage of males and females in that 70%. So, say 30 to 40% of males are overweight or obese out of that 70%, then I guarantee 100% of those males have low testosterone. And that's because of their garbage eating habits. Eating highly processed foods, sugars. Just, it's not worth it, man. It really isn't. I know you get a temporary dopamine hit, and it's hard to break because sugar stimulates your brain in the dopamine pathway, making you feel good and happy for a temporary amount of time. So, anyway, in summary, high prolactin causes low testosterone by inhibiting the two hormones responsible for stimulating testosterone production: FSH, follicle stimulating hormone, and LH, luteinizing hormone. And now we're going to discuss why I needed testosterone. So, I was born with a congenital kidney disease called polycystic kidney disease. I was diagnosed before birth. They saw this on ultrasound in the womb. It is a progressive disorder that it's a ciliary disorder too, so it affects the cilia of your body. Cilia have various functions. I'm thinking about making a anatomy and physiology podcast or like just educational style YouTube as well. So if you want to learn more about the body, stay tuned. I might come up with that, or I might start doing that. So anyway, cilia, yeah. So it's a ciliary defect. Affects the cilia all over the body. Cilia basically has various functions, mainly responsible for moving fluid and sensing fluid and all kinds of stuff. So this disease, chronic kidney disease, is a common cause of hyperprolactinemia. And due to this fact, that is what is solely responsible, more than likely, for my very low testosterone level, which when I got a test was 178 nanograms per deciliter. For a 23-year-old male, that is fucking terrible, considering I eat very, very healthy. I eat the same things pretty much every single day. I don't eat processed foods. I don't eat added sugars. I eat very low sodium diet. Not very low sodium, but I don't add salt to anything. I don't eat highly fatty foods except for peanut butter, but that doesn't really count because I make it myself. And a little plug, if you guys want peanut butter, let me know. I make my own peanut butter. I have a peanut butter business. So I have a bunch of different flavors. Leave a comment down below if you're interested in my peanut butter. So anyway, that's pretty much my story. Being 23, I have 178 nanogram per deciliter testosterone level. Prolactin was very, very elevated. It's the max range is 15, so it's very high. It's interesting how, I mean, being 23 years old, my diet's perfect. I work out twice a day as well. And that alone is insane. That should not happen. I work out twice a day. I do cardio in the morning. I strength train in the afternoon or evening. Like, I'm trying my best, man. I really am. Anyway, that's my story. If you want to learn more about my story, I'm going to make another video about that soon to come, just how I started, what my goal is with this YouTube channel, and how I can help you guys. That's my main focus, is helping you guys unlock your ultimate potential. That's all I want to see. I just want to see you guys thrive. So, not to mention, it would take for me to be happy and feel good and confident about myself. I would have to have the girl of my dreams approach me, ask for my number. I would have to take a fucking cold shower. It would have to be sunny and 75. I mean, the conditions would have to be perfect for me to feel good. Like, I would wake up and I would just feel empty. Like, nothing, I didn't want to do anything. It would take so much to make me feel good. And if you have any of those symptoms, depression, not depression, but like weird mood swings, no motivation, no creativity. That's another thing, is I had no creativity. I didn't want to create anything. I was so fucking lazy. It was just, I wasn't lazy. I was just unmotivated to use my imagination. Like, it sucked, dude. It fucking sucks. And I thought it was normal. I really did, until I went and got my testosterone checked at the clinic I'm at. Is called Elite Testosterone. So love them. Jenny, thank you if you're watching this. Love you. So, but anyway, yeah, guys, I just encourage you to get your testosterone checked, especially if you're having these symptoms. Biggest tip is to find a clinic that accepts insurance for the labs, because labs can be astronomical if they don't take insurance, especially if you do it through a physician. I would completely disregard doing it through a physician, because I tried that. They put me on androgel and it made my testosterone go down more. Okay? Like, that should not happen. It should not go down from receiving TRT. But it did. And I wasted my time. And I also wasted $96 a fucking month to put some gel on my shoulders that didn't do shit but make my arms really sticky. Like, okay. But anyway, I know I'm bouncing all over the place, but this is really just me helping you guys. It's very unstructured, but It's authentic. It's coming from the heart, honestly. So find a clinic that is within reason. I pay $200 a month for human chorionic gonadotropin, which stimulates the production of FSH and LH, like we mentioned earlier, stimulating testosterone production, your body to make its own testosterone while taking testosterone therapy. This helps prevent your testicles from actually shriveling up into like little dried up fucking raisins. And it helps bring a little bit of volume and protects them from atrophying too much and you losing complete function. So, also on an estrogen blocker, which is they sometimes give it, they sometimes don't. It just depends on how high your estrogen is. Mine wasn't super high, but they just wanted to make sure. And then my dosage for testosterone is 200 milligrams a week. Now, the dosage usually ranges from 100 to 400 milligrams a week, is the max. But they'll tailor it to your specific needs. I just encourage you to find a clinic that they know what they're doing, they have excellent reviews, and they specialize in testosterone optimization. Optimization is what you want. Just look around and especially call around and ask for clinics that accept insurance for the labs, because if you're going to go through a physician, you're going to be waiting months to get in to see an endocrinologist alone. Like it's a waste of time. I tried to schedule an appointment in November to see that same endocrinologist so I can get something fucking worked out. It was 7 months away. He was booked out 7 months. I was like, dude, I'm not waiting 7 months for this. And not to mention, what happens if all of a sudden it just spikes up on its own? And then I just waited all this time and fucking insurance don't want to cover the testosterone anymore because if it's above 300, they won't cover it, which is insane. They base it on a number. They don't base it on how you feel. I feel like a piece of shit but my numbers tell me different. Get the fuck out of here, man. Whatever. Anyway, and not to mention the labs are expensive as shit. So, yeah. Now, last thing I want to talk about is some common symptoms and misbeliefs about testosterone therapy. Now, hopefully, you are considering getting your testosterone checked. Say you did and it came back below average. What should you expect if you start testosterone therapy? Well, first, if you have sleep apnea, testosterone therapy may actually worsen sleep apnea. Now, granted, your nurse practitioner or the clinician you are speaking with or whoever you're dealing with, they'll take care of all of this. They'll make sure you're okay. They're not going to let you die because that's a huge lawsuit on them. They don't want that. And the chances of you having major complications from testosterone therapy is very unlikely. So unless you just have a serious amount of red blood cell production that your blood becomes too thick, which we'll talk about another thing is that's the next symptom is very thick blood, so very viscous blood because testosterone stimulates the red marrow of bone to engage in a process called hematopoiesis, which means to produce red blood cells. When you produce more red blood cells, your blood gets thicker, obviously, because you have more cells flowing through the bloodstream. Anyway, so that's another risk. And you also have an increased risk for clots due to the fact that the increased red blood cell production stimulated by testosterone on the red bone marrow. The fourth symptom is an increased risk for hyperplasia of the prostate. So your clinic will check a lab called PSA. So basically, it's a marker of too much growth in the prostate. It's just normal function of the prostate. So if it's too high, if it's above 4, if the PSA level, that's what they call it, PSA. If your PSA is above 4, then it usually indicates some kind of hyperplasia, which means excessive growth of the prostate. Therefore, you probably won't want to take testosterone because it can worsen this and it can make your tumor worse if you have a tumor. I'm not saying you do. They're going to check it. Mine was 0.8, for instance. And I don't know why I'm telling you all my lab values, but I feel like I should because it's important that I show transparency. So yes, mine PSA was 0.8, which is totally normal. And yours will be probably about the same, unless you're about 60. That's different. And the last symptom, which this one is the most common, is balls will shrink. I know, might be embarrassing. Mine haven't really shrunk that much. Just some information, just throwing that out there. But yes, they will shrink and it will be noticeable. Sometimes it may be very severe. They can grow, they can go from, say you got pretty good grape size and you can go from fucking big grape to down to a raisin. Like it's crazy how much atrophy can occur. That's why they usually give human chorionic gonadotropin. And you may experience infertility or just decreased fertility. Granted, I don't know how true this really is. It affects different people differently. It affects everybody differently. Take Chris Bumstead, for example. I mean, dude is on everything under the sun. He's definitely on testosterone. And he had a kid during the prime of his career. He had a daughter. So you're telling me that he can have children, but be on excessive amounts of testosterone, trend, steroids, you name it, anabolic steroids, everything. He's on it. You name it, he's taking it. I guarantee. So you're telling me that you can't have children while on testosterone therapy is a myth. It is still possible. Now, it depends on the individual. If you already have decreased fertility anyway, then it's probably going to make it worse. So that's a reason they give HCG coupled with testosterone therapy. Now, on to the misbeliefs. So, biggest misbelief that I see around TRT is the fact that most men think it's going to make them angry, or their wives or their girlfriends think, be like, oh, don't do that. You're going to be angry. No, it doesn't make you angry. That has been debunked. It does not increase your anger level. Anger is as a result of uncontrollable emotion. Okay. It has nothing to do with your testosterone level. So if you can't control your emotion, you're a weak man. And I encourage you to read some books. I got plenty of them, and I will recommend plenty of books that will help you control your emotions. So stop reacting and just start planning and taking action. Lastly, and this is more prominent in the social media world, especially, is all these influencers being afraid of losing their natty virginity because they're taking TRT. Well, fucker, if your testosterone's already low, that ain't normal anyway. So you're already not natural, because natural is, I mean, take for example, your grandpa probably had 1100, 1200 nanograms or deciliter testosterone when he was 20. I mean, and now most men have about 400. That's terrible. That is pathetic. So the fact that you're already low and you just want some aid into making you feel better, especially if you don't feel good, like if you feel like a piece of shit, that's not okay, dude. So I consider testosterone therapy to be natural. Absolutely. Like it shouldn't be low, especially if you're low. Now, if you're already in a normal range of like 6 to 900, then which is a healthy optimal range, depending on your age, obviously. But then you don't need testosterone therapy, and then that's when I would consider you not natural, because you are taking exogenous amounts that you don't need because you already have sufficient quantities. Granted, if you're less than like 250, then I think it's okay. You're still natural if you take testosterone, because your body clearly can't make it on its own. And that's what I consider myself still natural, because I can't fucking make it on my own. I just can't. My body just doesn't want to do it. So anyway, it shouldn't affect your people's views, shouldn't affect your body's decisions, how you want to treat your body. Like, who the fuck cares, bro? Who cares? If it's going to make you feel amazing and help you motivate yourself to, you wake up every day and you just think of random shit to do that's so creative, and you're just inspired by everything and you want to keep going and kicking ass every single day. Like, why does it matter? Who the fuck cares? They're all going to look at you and say, when you're, super rich and successful and you've achieved everything you ever desired and everything that you said you were going to achieve, and they look at you and you're like, oh, man, I'm so proud of you. Aren't you the same motherfucker that told me I'm not natural, bro, because I taken some testosterone? Get the fuck out of here, dude. Like, who cares? Go out and fulfill your purpose, man. That's all. I just want you to be the best. Now, here's some tips to naturally increase your testosterone levels if you don't want to take TRT therapy, but you want to increase it a little more. Say you're within the normal range. First is to exercise regularly. This should come no surprise to you, as I already told you in the introduction how not exercising decreases testosterone. Whoa, crazy, right? Working out increases testosterone because it decreases obesity, increases muscle mass, all of which are related to increased testosterone production. Second is to maintain a healthy weight. Again, this should be no surprise. We just talked about how exercise increases testosterone production. What happens when you exercise? You're able to maintain a healthy body weight easier. Maintaining muscle mass, losing fat, building muscle, all are tied together to increase testosterone production. If you're excessively overweight, you should probably put this phone down or whatever you're watching this on and go to the gym and just start working out, because clearly TRT is not going to work, especially if you're like 200 to 300 pounds overweight. And don't do Ozempic either, because that's not worth it. That's going to make it worse, especially if you don't work out. Most people, that's the issue, is with Ozempic, they take that shit and they sit around and they lose muscle and they lose everything and they fucking wither away and die. It's not worth it. It's not healthy. And they continue their shitty eating habits too, which blows my mind. What are you doing? So, and thirdly is to eat a healthy diet, especially eating foods that are high in healthy fats. So like nuts, eggs, lean hamburger meat, like 93.7. Grass-fed beef is what I eat. Grass-fed butter, healthy oils, stuff like that. Fish, salmon, love salmon. Make sure you're getting enough zinc in the diet. Make sure you're getting enough vitamin D, and which is another thing. I encourage you to stop eating processed foods. That's the biggest thing, is you don't need processed foods, because the only thing you're doing is you're filling your body with garbage just so you can temporarily occupy your mind with a little bit of happiness. It's not worth it. Number 4 is getting appropriate sunlight, or vitamin D. As I just mentioned, vitamin D levels are responsible for increasing testosterone production, also increasing overall mood. So when you see the sun, consider how you have your winter depression. Like, the season of winter is usually linked with, depressive episodes, because it's dark, it's gloomy, it's cold, there's no sunlight, and then all of a sudden spring comes around, season of growth. The sun comes out, you go outside, it feels beautiful, sun's glistening on your body, and you feel rejuvenated. That is because the sun stimulates production of testosterone. Not directly, but overall, it will help increase testosterone production. So it's all about maximizing or optimizing everything in your body for longevity and health purposes. I recommend getting at least 10 to 15 minutes of sunlight exposure. If you're on your balls, if you can. I'm just kidding. Don't do that. I don't want to get sued for someone else getting sued for public indecency. So don't do that unless you have like a massive fence and no one can see you in your backyard. Go for it. But I do not. Yeah, that's up to you. So if during the winter time, I really encourage you to take anywhere from 1,000 to 2,000 units of vitamin D, vitamin D3, which is the active form of vitamin D, at least 3 days a week. That would be sufficient quantity. Most people take 5,000 units every day. You don't need that. That's not way too much. Then you get vitamin D toxicity, and that's a whole nother slew of issues. So don't do that. Other supplements that may increase your body's ability to produce testosterone would be like herbs, such as fenugreek, which I've never even heard of this. Ashwagandha, which you have to be careful with ashwagandha, because there have been some articles that I've read that have led to increased creatinine in the body, which is an indicator of poor kidney function. So it has been linked to cause some kidney issues, kidney damage possible. So just use it to your caution, use it discretionary. and then obviously zinc and vitamin D. And if you do, I want to mention this, if you do get put on testosterone therapy, they will tell you to take an iron supplement. And that is because you're going to be making more red blood cells. And if you don't have enough iron, that'll be a pretty bad day when you need to make more blood cells, and you'll become anemic because you don't have enough iron to make new red blood cells. So anyway, in the grand scheme of things, if you're feeling any of these symptoms that I talked about in this video, which I've personally experienced, I recommend going and getting your testosterone checked. It's up to you. Your life is in your control, so you forge your own path. I am not a physician. This video is meant for educational purposes only. So I'm not a physician. Please heed my advice and obviously take advice from a registered medical practitioner before just diving in and doing something that may be potentially dangerous, especially a controlled substance like testosterone. However, I only want to see you guys, my audience, grow and unlock your ultimate potential. So I would never put you guys in a dangerous situation like this. Like, I'm on testosterone therapy anyway, so I wouldn't enforce something that's not safe. Okay. I just want to see you guys unlock your potential. And that's it. So anyway, that's all I got for you guys today. I hope you guys learned something of value. I hope you apply this and you take action, getting your testosterone levels checked, and hopefully getting some TRT to help you feel better. Now, who cares what other people think? Focus on yourself. Focus on making yourself feel better, optimizing your life. Doesn't matter about anyone else's, okay? It's your body. You get one life. Optimize it. Take care of it. Make it the fucking best you can. Build a temple. Make your body a temple. Anyway, remember to leave a like and comment if you found this video helpful, and subscribe for more self-improvement and fitness content. I will catch y'all later. Take care. Love y'all. Peace.